Welcome back to Beyond the Chart, the podcast that takes you beyond the chart and straight into the hearts of healthcare. We're so glad you're joining us today for another one of our episodes. Today's topic is one that affects millions of people but often isn't talked about enough, and that is urinary incontinence. It's a common condition that can impact quality of life, but the good news is that there are treatments, resources, and support available.
Joining us today is someone with a remarkable nursing career spanning more than 3 decades. From her early days as a forensic psychiatric nurse to working in emergency medicine and serving with the California Department of Corrections. Nurse Kathleen has dedicated her career to caring for others and advocating for her patients.
After retiring in 2021 to spend more time with her grandchildren, she couldn't stay away from nursing for long and unretired in 2023 to join Heritage Victor Valley Medical Group as our health nurse educator. We are so excited to have her here with us today to share her knowledge and help shed light on this important topic.
Please join us in welcoming Nurse Kathleen to Beyond the Chart.
Yay. Hello, welcome. We're so happy to have you here.
Yes. Nurse Kathleen, go ahead and tell us a little bit about your role being a health nurse educator here at Heritage and what made you come out of retirement and come to Heritage.
Well, I had initially retired after over 30 years as an RN. I know. I went to live with my son and his wife to be their granny nanny for their 2 kids. That's the best job you can have.
Granny nanny, I like that name.
And but after a couple years, the kids got older. They were in school. They didn't need me full time. And I missed being a nurse. So I saw, I was looking around for something part-time, but I saw the opening at Heritage as a health educator, which is a big part of what I had done in corrections. So I interviewed, and I was kind of skeptical because it was full-time. I didn't really want full-time, but they offered me the job, and I'm so glad I took it. It's a dream job. It's been just the best job of my career.
We love having you.
I've had a really good career, so that's a compliment.
Wow, that is.
So as the nurse health educator, my passion, and it gets to me my job description, is I help people learn how to take the best care of themselves, how to get stronger and have more vitality and live their best life. And that's really exciting for me.
Yeah.
Good.
And I feel like you're famous at our resort because they all, Nurse Kathleen's coming today. They're just so excited. So you have a huge following, even if you don't know what you do. Our members love you. So we thank you for that.
Thank you. No, it's wonderful for me because when you're a nurse, a lot of times you're helping people who are really struggling.
Yeah.
And that's part of the job sometimes. But what I love about Heritage is I'm working with people who have the potential to get way better. And that is what's exciting for me. I heard the term, they're calling it the welderly.
Elderly
people who are on the path to learn and grow and contribute, and that is super exciting for me because the possibilities are really limitless.
Yes, of course. We love the education too.
We do. We learn a lot ourselves.
We learn a lot.
Okay, so today's topic, urinary incontinence. So let's put that for our listeners in simple terms. What does that mean?
Urinary incontinence it's a basic term meaning that you can have a small leakage. It means basically that your bladder is not as well controlled as for a lot of reasons. So you could have a small leakage or you could have a more serious problem with it.
Okay. And then is this something that happens only like with aging, or does it affect people in different stages of life per se?
Well, it can happen. It can happen to anybody. There is an increased risk of it, or an increased possibility of it as you get older. But it affects men. It affects about 25% of men for different reasons. But it's mainly a woman problem. It's mainly a female problem. And the biggest contributor is being pregnant or giving birth,
Childbirth.
because that takes a toll on your
Definitely.
system, right?
Yeah.
And so the numbers are that 50% of women are incontinent, but I think that's not accurate. I would say 80%.
Oh, wow.
To my experience, 80% of women who have given birth have at least some level of incontinence.
Maybe they just don't like to talk about it, so we don't have those statistics.
Nobody likes to talk about
Yeah.
it, right?
Yeah.
Yeah.
And frankly, still, women's health issues are not as well funded and not as well known and researched as I would like them to be. It's getting better. It's getting way better.
Good.
But yes, that's part of it.
So you're talking about different types of incontinence. So there's actually more than like stages, right? Like there's more than one
Right.
stage.
There's different kinds of incontinence. The most common is called stress incontinence, and that's the one that women have after they've given birth. That means that if you cough, you could leak. If you try and jump on the trampoline with your kid, you could leak. You go to a Zumba class. So that just means any extra exertion on your bladder, you're going to have a small leak.
Oh, wow.
I know. No, it's just super common.
Yeah.
And that just means your bladder just can't, the sphincter of your bladder just can't contract as it normally would, as it did in the past. So, but there's also an overactive bladder, which is means your bladder will give you the signal that you need to go more often, whether you actually do need to go or not. So part of the problem is we get signals from the bladder that we need to go, but we don't really know how much is in there, how much urine is in there to
How much
pee.
we really
So
have to go.
sometimes you feel like, oh, I have to go. And it'll just be drops. You know, so yeah, so that's part of it is, becoming aware of the symptoms. There's also, there's functional incontinence, meaning that it's hard for you to, if you have like arthritis in your hands, or it's hard to get your jeans unbuttoned. It's hard to get in the door if you've got a walker or a cane.
That's okay.
So that can be hard. Barriers to getting to the bathroom can be a factor. And then there's a thing, I think a lot of people would be aware of this. It's called latchkey incontinence.
Latchkey? Okay.
I have had
Sounds interesting.
I've had it for years, and I didn't know what it was. That means, so you feel like you have to go, you're going to the bathroom, you have to go. Maybe you could have gone a little earlier. Maybe you're pushing it a little bit.
You're waiting.
So you open the door, and your bladder goes, we made it.
Okay.
We're going to go. That's an incontinence. And like if you're in a store or something, you're in the restroom, and you just open the stall door, and you go. Your bladder's like, I made it this far.
I'm in the bathroom.
Good for me. Yeah. So that's called latchkey incontinence, and there's ways to address that too. But I thought it was really funny. So,
I haven't heard of that one, so thank you for
had I.
I mean, you don't think it's an actual diet, like it's a real thing. So some people probably think, oh, I went, but they don't think that's an actual incontinence.
Right. And you can do something about it. So that, to me, that's the point of this whole conversation, is for people to be aware there's treatment available. It's super common. There's lots of different parts of it, and there's treatment available.
Yeah, definitely. Yeah. Is there something that people should, that they should think is normal? Like, is there something that isn't, or is there something like a regular, how would I say this? Like, it's okay for you to have used the restroom, and they think that's an incontinence, or is it always? Is there something that we should
Like a
look
sign,
for?
like
Like a sign? Like, is it something that is not normal anymore?
Well, sure. A part of it. So the incontinence, first off, people who have any kind of a symptom of incontinence, it broke my heart to learn that they wait 3 to 5 years to talk to their doctor about it. And that just makes me so sad, because there's help. There's so much that you can do to address it. And because especially women, and especially sometimes speaking to a male provider, they're just uncomfortable talking about it. And that just means the path, the road to get treatment, you're not going down that road yet because you haven't talked to your doctor about it. So that's a big part of what I do, is try to just say, talk to your doctors. But the symptoms kind of come on slowly, of course. And I would say when it gets to really affecting the quality of your life, for sure, that's when you want to talk to your doctor about it. When you don't want to go on road trips with your kids. When you, one of the people in my class even today said, I have friends that have a boat, and I get invited to go out on the boat all the time, and I don't want to go.
Because there's no bathroom on the boat.
Because there's no bathroom. If there's a conference or the farmer's market, you want to go to the farmer's market, I don't think they have bathrooms. You know, they might have porta potties maybe, but if you're going with your walker, you know, it's just a question of, is it easy to get there and use the facilities, or is it a barrier and not worth the effort?
It's like an added stress to every daily activities.
So that's the if it gets to where it's really affecting your ability to enjoy your life, do the things you would like to do, then it's time to talk to your doctor about it and get some help.
It's a good way to put it, just with the quality of life. What are signs that it's more than just occasional leakage? So that one sneeze or cough and you have the occasional leakage, is there more signs than that?
Well, it's for everybody, it's just how much does it affect your life?
The quality of life.
But you look at, besides the inconvenience, are you getting up to go to the bathroom a lot at night? Some of that, as we get older, is a little bit more common. Well, you guys have probably heard me in the class. It's normal if you're a senior. I'm 73, so it's great for me to be able to relate. Like everything I talk to them about, I've been there. I know. You know, so it's normal for a senior to get up 2, maybe 3 times to go to the bathroom at night. If it's more than that, then it's affecting the quality of your sleep. It's affecting the quality of your life. So that's kind of a guideline I give, one of the guidelines. And then people always go, well, it's frustrating when you're older and you have to get up and get up.
Right.
And they go, oh, well, when I was young, I could sleep through the night. I never had to get up and pee. And I always go, well, when you were young, you could also get up off the floor. So
cross-legged on the floor and get up.
Things change. So you just accommodate. If you get up and you can go right back to sleep, it's okay. If you're getting up a lot and then you can't go back to sleep, or you get up and you're not making it in time to the bathroom, again, then it's time to...
It goes back to knowing yourself as well, right? Paying attention to the way that your body's changing.
Is it becoming a problem for you?
Yeah.
You know?
Would you say, like, we're experiencing the occasional leakage, but now I'm to a point where, like, I need to wear, like a pad, or that would be, like, another symptom, like, hey, this is increasing. Maybe this is more of a concern now. I should bring it up as well.
Right, and that's the other thing. Using the accessories or the briefs or the pads, or there are a lot of those available, but they're uncomfortable.
Right.
They're not hygienic. They're super expensive, and it's if you're on a limited budget, then that makes a difference. And so
I feel like it also could affect like their mental, like they get to a point where they're like, why do I have to, like they have to now wear it, so they're embarrassed, or they don't want to do it
and
anymore.
that's always the struggle too. And it can be concerning. So time to get treatment.
So speaking about treatment, so let's say I'm going to go in, talk to doctor. What are the first steps when a patient comes in and they do express this concern? What are we going to do to get me on a treatment plan, right?
The doctor, there are so many treatment options, and that's what's really exciting for me, and that's what I want people to realize. But the first thing the doctor will do, they'll look at your medications to see some medications have an effect on your urinary status. Some people are on a diuretic for whatever reason, Lasix or hydrochlorothiazide is another one. And that, of course, if it's a diuretic, it's making you go to the bathroom, and that's going to be a problem. So the doctor can adjust the dosage. The doctor can suggest you take it in the morning. They'll look at that. Some blood pressure medications can affect continence. Not a lot, but that's one of the first things the doctor will run labs, make sure your kidneys are working okay. Of course, they'll do a urinalysis, and so they'll do a baseline assessment, then take it from there. They can refer you to a urologist. There's also a specialty that has really come around more in, I think, the last 5 years, a pelvic floor therapist, because the pelvic floor is a sheet of muscle. Your diaphragm is up under your lungs, and your diaphragm, it doesn't pull your lungs down, but it supports your lungs and helps you to breathe. The pelvic floor is a wall of muscle that supports your abdominal organs. And as that, I don't want to say collapses, but as that weakens and drops, that can affect everything. Yeah. So a pelvic floor specialist can do a full assessment and then see what would help with that. There are exercises, there are other interventions they can do. Okay. So you could be referred to a urologist, a pelvic floor specialist. Yeah. There's prescription drugs to help with incontinence. And I want anyone who uses a prescription drug to be aware if they take one and it's helpful but has side effects they don't like, get right back to the doctor. Mm-hmm. And go because there are several other, there's not just one. And so be in communication with your doctor. This is helping, my vision's getting blurry, or whatever. Mm-hmm. Be aware, no matter what prescription you take, you should be aware of side effects anyway.
I'm glad you said that, because I think a lot of people are like, oh, my doctor put me on this one prescription and this is it, right? But in reality, we want to know the side effects. We want to know, because there are others out there, and let's try something new. I always say sometimes you're making your cocktail, you're mixing. Right. You need the right cocktail for your body. That's how I think of it sometimes.
Having medication management.
Yeah.
It's true. And always, and you've heard me say this so many times, you're the captain of your healthcare team.
Yeah.
You're the one, you know your body, you know your life, you know what works. Mm-hmm. And so finding the right medication, managing side effects, sometimes the side effects aren't that bad and you can deal with it. So, so they'll take a look at that. And there are also, there are multiple surgical interventions.
Okay, I was going to ask that.
Bladder Botox is a thing.
Oh, wow.
It relaxes the bladder muscle walls so that you don't always feel like you have to pee. Mm-hmm. And I think there's more surgical interventions. Oh, there's a thing, you know what a TENS unit is for muscles, the electrical impulses. There's one that you can go onto your bladder, and then there's a controller it's kind of like a pacemaker. Okay. And so, but you can adjust the intensity of it, and that helps. People who have used that have been really pleased with it. My mom had Parkinson's for decades, and she ended up using hers was called an InterStim, and she loved it. She loved it. So there's just so many. There's inserts called pessaries, which help support your bladder. Mm-hmm. So we just need to ask the questions. Yeah. First, you have to tell the doctor, right? This is what's going on. That's step number one, because if they don't know, if you go in for shoulder pain and the doctor goes, "Is there anything else?" "Oh no, there's nothing else. I'm fine. I'm fine. Thanks for taking care of my shoulder." No, that's when you say, "I'm having a problem with this." and let them document that. Let them start looking into it.
What do you think is one reason or some reasons, like just based off of your experience or what you see, what you know, what do you think is the reason why people don't like to tell their doctors? What are some reasons that you think?
Well, it's embarrassing. It's embarrassing.
Right.
You know, especially my generation of women were raised to be pretty modest. And like I had mentioned earlier, we have great providers at Heritage. Many women my generation are uncomfortable talking to a male provider about gynecological things or something like urinary incontinence. It's just a modesty or shame or shyness. It's really, really hard.
Yeah. Now, if we're talking about Heritage, we do have a lot of male providers, right? There's also that opportunity where you could ask to see a gynecologist as well. Would you recommend that too? Like, say if I do have a male provider and my gynecologist is a female, as a woman, can that also be something that a gynecologist can tackle with me?
Absolutely.
Okay.
No, absolutely. If you wanted to bring it up first with your gynecologist, absolutely.
Okay.
Because that's their field. You know,
Right. They're
as
gonna
much as the primary care provider.
Okay.
So sure, that's a really good shortcut.
Okay. I like
Yeah.
because that way, if that gynecologist is a female, right? I mean, I'm not always gonna say they are, but if they are,
Right. Well, and we've found one of the things I'm really like about the class. I just did the class this morning, and the teaching and training that the nurse educator has been able to do is to practice that conversation.
Yeah.
Like I feel like the women in my class are just so happy,
They're confident
to be able to have the conversation, you know, and to say, oh gosh, every single person in this room has experienced that.
Yeah.
And that it makes them feel like not isolated, and that really helps with the discomfort of having that conversation.
yeah. And I know Heritage as a company is working with our providers to bring this up, right? To make it more comfortable for them to talk about. So I'm happy to hear that. I know that's going on. So they're working on it. Males talking to everybody, right? Male and female. Because males experience this as well. So just trying to get everybody on the same page and being open and honest and able to talk about this.
Absolutely.
and knowing the resources too. I feel like a lot of people don't know. You know, they don't know that they can talk to their gynecologist, and they're like, what is my primary care going to do about this?
Right.
They don't know what there really is out there because they don't know their
They
resources.
don't know what
They
the
don't know what they
options are.
have.
Yeah.
You know, oh, well, I guess I'll just get a bag of Depends and
Call it a
live my
day.
life. Yeah.
Yeah. Are there any like just daily habits, right, that we could do now? Maybe we don't have any of the symptoms yet, but is there anything we could do ahead of time to maybe prevent it or help it in the future?
Well, the best thing is if you start to notice a problem or you start thinking there might be a problem, there's some basic lifestyle changes that can make a difference. The best one is, in my class this morning, I passed out a Bladder diary where you kind of keep track, you just track what I ate and what I drank, and then how did that affect, how often was I going to the bathroom, what was the urgency on that. There are a lot of things that are bladder irritants, obviously caffeine. Because, you know, you drink a cup of coffee and then...
Gotta go.
Or a Coke, or, you know, you got to go to the bathroom. Carbonated beverages of all kind, even just sparkling water. I don't know why that is, but that is the carbonation is a bladder irritant.
Oh, wow.
Right, and it's different for everybody, and that's why tracking it is a really good idea. Because then you go, okay, well, I had a soda, and then I was going to the bathroom every half hour the rest of the day, or, you know, whatever. Then you can say, okay, maybe I won't have that soda. Or that even, like I said, the sparkling water even could be a problem.
Like, especially if you know you're going on the boat, right? And you don't have
my
the
gosh,
bathroom.
yeah.
So you know not to drink soda before.
I'm coming up the
pass.
I'm going through the pass.
Yes.
I'm coming up from down the hill. And so I'm not going to have Other things are citrus, acidic foods, tomatoes.
Okay.
Oddly enough, tomatoes can be an irritant. Spicy food, all the good stuff, spicy food. Tomatoes, of course, alcohol along with caffeine. But again, it doesn't mean you can't have it. It just means track and be aware.
And be aware you're going to,
Right.
you got to go.
Right. Are you putting yourself in a bad position? Are you not managing your own symptoms very well?
Are there exercises? I've heard the term Kegels. Can we do that? Is that not?
Okay, I'm going to be just really honest.
Let me hear it.
About Kegels. And I said
Oh,
this
Kegels. Is it Kegels?
Yeah, and I said this in the class this morning. Okay, so this is me speaking as a woman.
Yes.
And I am a nurse, so I'm a woman nurse. Kegels are just a common, I don't want to say excuse, a common thing to say to someone who's having that problem. Because for a very long time, Kegels were all there were. So we're back to women's health. Could have been better all these years. Is getting better. I'm happy about that. But no, Kegels, should I say for the listeners? Kegels?
Yeah.
Yes.
Kegels are like an isometric exercise where you flex the muscles when you're urinating. So you, say you're peeing, and then you try to stop that flow. Those are your muscles that you're flexing in Kegels. So the theory is if you work those muscles, like any other muscle, if you work those muscles,
They're going to get strong.
get some little barbells down there, and then that will take care of it. Well, that was back in the day. That was all we had. But I'm going to tell you the truth about Kegels. They don't freaking work.
Okay.
They don't. So, and for them to work even as well as they do, which is not much, you would have to do 3 sets of 10 to 15 Kegel flexes a day.
Wow.
For 12 weeks to maybe see some difference.
Okay.
So,
okay.
And that's maybe.
So I'm like, why don't I just quit my job, clear my social calendar, and do Kegels the
And
rest
sit
of my
there and
life?
do Kegels.
And it might not still help.
Yeah.
Oh,
So,
Okay.
so if you go to your doctor, but again, back to especially the old school doctors, that was all they had.
Yeah.
And they'd say, okay, do your Kegels.
Sure.
See you
Aye,
later.
Captain.
Yeah. So if you go to the doctor and they say Kegels, that's fine. They're doing their best. But just say, okay, doc, and what else?
Yeah.
Okay.
Let's look at some prescriptions. Could I get a urology referral? Could I, don't accept Kegels as the answer because they're not.
There's more to it.
There's
We could do more.
no. You could do more.
Okay. I think that's great because I think a lot of people just hear that word. And then the word is like, ugh, So we already don't like the word and we don't like urinary incontinence. So then it just puts a bad name on it, right?
No, and it's not helpful.
Yeah.
So
Do you think we
I didn't
covered?
even know about
I
Kegels.
didn't. Oh, you.
I mean,
oh.
I knew what they were, but I didn't know that was what it was called.
After I had, and this, I mean, my son's 6, right? So this was only 6 years ago. They said you should do these exercises, and I said, okay, but how? So but then I asked for more, and they sent me to a pelvic floor therapist, and so I knew about that. But I know a lot of women, and men don't even understand what the pelvic floor exercising and all that kind of stuff is. So, that's huge to know. So thank you for that.
well, and the pelvic floor specialist might say Kegels, but they will give you that strict.
With other things, right?
With
yeah.
other things.
Yes.
So I don't want to.
Knock the Kegels.
Yeah. Well, I do, but.
She's like, no Kegels.
But no, I mean, it certainly should not be the only thing you try because it's not going to solve the problem.
Okay.
There's more to it.
There's more to it.
There's more to it. All right. So we asked this question to all of our guests. Our guests, for our listeners, if there's one thing that they could take away from today, most important on urinary incontinence, what would that be?
Talk to your doctor.
Talk to the doctor. Yeah.
And if you feel like your doctor isn't listening, talk to another doctor.
Okay.
Change that doctor.
The best description I heard of urinary incontinence was it's not a life-threatening issue, but it's a quality of life life-threatening issue.
Right.
And in your senior years, you deserve to have your quality of life be the absolute best you can make
Of
it.
course, especially after you retire, right?
Yep. Be the welderly.
Elderly. I love that. We got to start using that.
elderly.
All right. Well, thank you to all of our listeners and to you, Miss
Thanks for having me.
Kathleen, for joining us today on another episode of Beyond the Chart. Be sure to follow us on our socials. So that's Facebook, Instagram, LinkedIn, YouTube, what am I missing? TikTok. We're on all of them. We would love to have you guys like, subscribe, and follow. And of course, follow on YouTube so you don't miss another episode of Beyond the Chart. So until then, I am Candace.
And I'm Teresa.
And thank you again for listening to Beyond the Chart, the podcast that takes you straight into the hearts of healthcare.